So my name's Dr. Ollie Hart. I'm one of the GP partners here at the Sloan Medical Centre. Working with Bob and his wife Dorothy has really been a great example of a new way of working that we've been following over the last year or so. We're seeking to be much more in a partnership approach rather than us as healthcare professionals telling people what to do. It works really well with someone like Bob because he's highly activated. We know from his patient activation measure he's at the top end of the scale, and we're able to follow his lead really in what we do. So he will determine what he's going to do, what his priorities are, and we can work as a partnership with us deciding how we can support him in what he wants to do to look after himself. It's been really successful with his diabetes. It's enabled us in a partnership approach to get him to a point where he's adjusted his lifestyle, and he's made some of the changes that have really helped to get his type 2 diabetes much better controlled, and it's actually even enabled us to stop some of his medication. And there's so much benefits to that. It's great for Bob to feel like he's more in control, and he's the one taking the lead rather than us, and rather than just popping pills to control his condition, he's doing things for himself, much more empowering, and gives himself much more confidence.
My name is Bob. I was diagnosed with diabetes type 2 about 20 years ago. I was probably nearly 17 stone. The doctor told me I could do it with diet at first. I had no medication, and then the diabetes got worse and ended up on medication. I lost 2 stone, come down to 15 stone, but then my sugar levels got worse. I was summoned to see Dr. Hart at a meeting for diabetes, and the meeting helped change my lifestyle and my life. I decided to do something about it. That's what I did.
You were so focused.
I was very focused on what it, because in my head I was frightened of what might happen to me. I set myself a goal to do something about it, to try and reduce my weight, stop the type 2 diabetes and alter my lifestyle. My aim was, my goal was I didn't want to be a burden on society, a burden on Dorothy and
the
NHS, basically. And I didn't want to keep coming here and having tablets. I hated taking 10 tablets a day.
I think a lot of people don't realise that type 2 diabetes can be controlled by diet and hence have no medication. And I think that was something, because he said when he phoned him up and saw the results of his blood test at the end of this, whatever it was, and he said just throw your tablets away, and he threw them all in the air, and it was just
I actually cried.
Ollie Hart, it was in tears, and he was saying you're amazing, come and tell us how you do it. And
that's why we sat here now, isn't it? Just tell us. He did. He wanted to know how I'd done it, and I just said, well, I just followed what you said, what we had meeting, and I've just stuck to it.
I'm Joanne, I'm one of the practice nurses at the Sloan Medical Centre, and in the last year we've changed our approach, particularly in how we look after our diabetes patients. Whereas previously we had a very tick box approach for all patients, one size fits all, where we were seeing them every 6 months, every patient had a 20-minute appointment with a nurse. We found that it probably wasn't the best time of ours or the patients, so we've changed our approach where we look a bit more at coaching the patients that need the help rather than just giving them more medications or doing the foot checks and just checking we've got our QOF box ticked. So some patients now, rather than coming to see a nurse straight away, we can direct them to other agencies like Age UK, health trainers, or we have a digital surgery who can perhaps prepare the patient better in a way that's more appropriate for them before they do actually come and see a nurse or a doctor for more clinical advice.
I filled the PAM in. I thought it was constructive. I looked at it. I thought, well, all the questions. I think 12 or 13 questions. I understood them. I understood them all, and they were quite relevant to what my problems were.
So working with Bob's enabled us to take much more of a coaching approach. Because he's more highly activated, he can take that approach, and that works really well. It doesn't always work for everybody, and we're using things like the patient activation measure to help us decide how much support people need. So if people are highly activated, then we can really let them take the lead and tell us what to do, people like Bob. People who are less activated, we take a much more softly coaching approach and very gently try and nurture them to the point where they can start to take a little bit of a lead. But recognise that the burden of managing your health condition can sometimes be really overwhelming for people at lower levels of activation. So we have different approaches. It's not one size fits all.